The Health Insurance Marketplace is a federal program that provides health insurance plans to adults, families, and small businesses. Ann Packham with the Primary Care Access Network, or PCAN, is here to tell us more. And I was not familiar with this whole program, Ann. So the Primary Care Access Network, so basically what do you do?
So PCAN's original mission was to help people in Orange County who were uninsured or underinsured find a source of primary care. And it continues to be our mission, but we added to that in 2013 the goal of getting people health insurance on one of the federal programs or state programs that exists for them.
Okay, so using your service, is there any cost involved, or is it an easy to use and contact you?
It's very easy. So navigators are funded by the federal government. They're funded by your taxpayer dollars, so we don't charge. And that's different than maybe an agent or a broker who could charge a fee or is collecting commission. We don't work on commission, so everything that we do is absolutely free.
And we know that term, the Health Insurance Marketplace. So what types of services are available, and what's kind of a brief overview of that?
So the Health Insurance Marketplace is a place where people can go and shop for private health insurance. The main platform that is healthcare.gov. And when you go to healthcare.gov, you fill out an application with your basic information, your demographics, and your income. And based on your income, you get immediately a letter that says, you're eligible to get on the marketplace, and here's how much financial help we'll give you, because a lot of people, most people can't afford to buy health insurance just on their own.
And, maybe they have health insurance through an employer, and now they're in that situation of they're unemployed and gosh, what do we do? You don't ever want to be without health insurance. So is this something they can contact you?
Exactly. This is for people who don't have health insurance through their employer because they're either retired or they're working part-time, they own their own business, they're working for themselves. So this is a place where you can go and get coverage and get financial help to pay for it, the way your employer would have been chipping in their portion if you were employed full-time.
Right, and so, we talk a lot about elder services here at Active Lifestyles, but this is really a program for any age level.
So basically, there are a lot of people between 55 and 65, that age range, who are on the marketplace. Why is that? Because they've retired, or they're semi-retired. Maybe they're here taking care of their grandchildren, taking care of an elderly parent, and they need health coverage, but they're too young to qualify for Medicare. So it turns out that looking across the state, the #1 group that we actually help across the state are people in that older demographic who, I said, don't going to get through an employer and really need health coverage.
And speaking of health coverage, and off camera, you and I were kind of chatting about this, how important health coverage really is, because I think, a few years ago, if you were in your 20s and you were, you felt, well, I'm pretty healthy, why should I be involved with, paying extra for health insurance every month? But then something can happen. And you mentioned you can fall off your skateboard and break your knee or break your leg, and then you wish you had that health insurance. So why is it really vital that folks sign up?
There are two main reasons. One, if you don't have health insurance, your access to care is greatly diminished. You will not be able to get, most often, an appointment with any specialist without having health insurance. They won't cover it. You can't get access to tests. So you may be able to find a clinic where you can get primary care for very little or for free. But then what? What happens if you do have a chronic illness, or you have cancer, or you do fall off your bike or your skateboard and you break something and you need to go to the orthopedic doctor? You don't have any coverage. The second thing is financial security. The #1 reason why people declare bankruptcy in the United States is medical bills. So if you don't have health insurance and you go to the hospital, even the emergency room, or you have any kind of big catastrophic event, you could owe a lot of money.
It can be catastrophic.
Exactly.
And I know there are certain time periods for, say, enrolling in Medicare and other programs. So is there a time for enrolling in this?
There is. The open enrollment is generally in the fall. Generally starts November 1st and lasts about 6 weeks. Outside of that, you have to have one of the life qualifying events that allows you to get on the marketplace. So that would be losing your coverage, maybe through an employer or Medicaid or through a spouse. Something like that, having a baby, change in immigration status. So yeah, it's really important to keep aware of the dates for the open enrollment.
So, Ann, I appreciate you explaining why we all need insurance and how the Health Insurance Marketplace can help get people covered. Don't forget to contact a PCAN navigator to learn more. Thanks, Ann.
Thank you.